I'm Marina Kremyanskaya. I'm an associate professor of hematology oncology at Mount Sinai Hospital. I am married. I have a husband and a son who is 8 years old. I moved to the United States with my family when I was 14 years old. I was born in Belarus in former Soviet Union. My grandparents were physicians there. I remember multiple times walking outside on the street with my grandfather, for example, and people would stop him and say, thank you so much. You did so much for me. So I think that's what made me consider medicine as a career in the first place. I became interested in hematology oncology, I think in medical school, as I ended up doing oncology rotations. And that really spiked my interest and looked like something that I would be interested in. Malignant hematology is a very interesting field. You really take care of the whole patient. You really become sort of these patients' primary care doctor. 2 days a week is when I have my outpatient clinic. I would say about 60-70% of my patients are MPNs. The first step is to explain to patients what these are and that, yes, we will take care of you and you will be okay, but it is a disease that can progress. That is a difficult conversation, especially for patients that are younger. To really understand what these patients need and how to take the field forward, these interactions with patients are essential. Because as physicians, you can get a lot of information from the publications and from the experts presenting at the conferences, but the real life aspects of this only come from patients. It's the patients that tell us what we need to do. That's 2 days a week. The other 3 days, I can focus on my academic pursuit, which includes clinical research and reviewing the literature, things like that. Clinical research is very complicated. Appropriately so, it has to be very tightly regulated to get to the point where we can offer it to a patient and say, we have this clinical trial. It takes a lot of time and it takes a lot of effort. And it really requires a huge team of people with variable expertise. And I would never be able to do this without them. Part of our job as being a professor at medical school is that we were involved in teaching residents and fellows, medical students as well. Specifically, since this is hematology oncology, we're very involved in teaching internal medicine residents and hematology oncology fellows. When you have that trainee that is really excited about what they're doing, and you see that excitement when they're learning something new, and that knowledge that they've gained from their interactions with you, it's nice to be able to see all of that happen. What I really like about being a doctor is the relationships that I develop with my patients. And when they're doing well, and when we're really providing the care for them that they need, it's really rewarding. Of course, the opposite is also true. Our patients can get very sick. Things don't always go well, and that's also really, really hard to deal with. But I remember what my grandmother has told me over the years. I mean, she became a doctor at an extremely difficult time. It was right after World War II. There was no equipment, there were no medications, and there were a lot of very sick people. The most important thing she always told me is that be kind to people. Everybody deserves to be taken care of. And I think that's what really came through to me.